You didn't do your training here. What attracted you to Stanford as your first faculty job, and what's kept you here?
Yeah, so I finished my, so I did my medical school at Yale, and then I did my cardiology fellowship at UCLA, and then did my PhD afterwards in pharmacology. And then I came here in 2004. And after my training, I had several choices in terms of universities I could go to. But I think for a couple of reasons. One is that, I think Stanford really represents the combination of academic excellence, clinical excellence, and also a great nurturing environment. And that was part of the reason why I came to Stanford in 2004 as an instructor, and then later on as an assistant professor. And I've been here ever since then. And I find it one of the greatest, if not the greatest, place to work in. My colleagues are outstanding. The research environment is outstanding. The weather is nice. The locality is also great to raise a family. But really not much complaints, and that's the main reason why I've stayed put for the past 16 years.
One of the things I admire about you is how collaborative you are. You collaborate with people all over campus, all over the world. Talk to me about some of how Stanford makes that possible or facilitates that.
I think, part of it is, several reasons. One is that, we're in California, and people in California are just much more relaxed, much more, I guess, for lack of a better word, much more cool than other states. And then the other reason is that it's just a environment that goes from the top down, meaning that, if you see the professors are very collaborative, then by default, the chances of the associate professors being more collaborative, the assistant professors being more collaborative, the instructors, the postdocs being more collaborative. And so it just, it has the culture, it has the vibe here. And if you take a look at our collaborations, our publications, it consists of PIs and postdocs from all over the campus. And that's just a model that we aspire to, and we've been able to take advantage of, given how smart the different faculty and how smart the trainees are here.
Talk a little bit about the Cardiovascular Institute and why it's an important feature of what we can offer.
Yeah, so the Cardiovascular Institute was formed back around 2004 by my mentor, former mentor, Dr. Bobby Robbins, who was both the CT surgery chair as well as the director for the Cardiovascular Institute. And he left, as many of you know, to become the president of Texas Medical Center, and he's currently the president of University of Arizona at Tucson. And I was fortunate enough to, tapped by Dean Reiner to be the CVI director after Bobby left around 2013. And really the mission of the Institute is to provide a nurturing environment so that we could promote science, education, and clinical work. There, just for the audience, there are several institutes, but mainly Stanford has the Cardiovascular Institute, the Cancer Institute, the Stem Cell Institute, the Immunology Institute, and the Neuroscience Institute, which is a university-wide, whereas the first four institutes are within the School of Medicine. And the institute members all work collaboratively for a joint mission, which is to advance science here. And I've had the pleasure to work with many of our institute members, ranging from professor to down to graduate students, and it's been a blessing. It's I'm having a blast. I've had a blast, and I'm still having a blast. So I look forward to working with cardiology fellows who may decide to come to Stanford for their cardiology fellowship training.
But one of the things that, from my perspective, that is so important is the educational mission. Maybe you can talk a little bit about the seminar series that the Institute provides, and also the summer training programs, especially to increase diversity and inclusion within Stanford.
Yeah, so I can give you the whole spectrum in terms of how much we cover. I think from the undergrad perspective, the Institute has a NIH-funded R25 grant and also an AHA-funded grant in which the goal is to promote diversity for among the students. So we have undergrad who come from Puerto Rico, come from Guam, come from Morehouse, Spelman, and different universities across the country to come here for a 8 to 10 week intensive training on cardiovascular research. In terms of the medical students and the graduate students, we have a gift from a foundation in which we provide medical students scholarships so that they could do research during their medical school years. In terms of the pre-doc and post-doc level, the Institute has three training grants, T32 training grant, one in imaging, one in vascular biology, one in myocardial biology. And we take close to about 15 trainees a year. And the cardiology fellows are highly encouraged to apply for these T32 training grants. We also have a R38 grant. The R38 grant is geared toward medical residents in radiology, medicine, CT surgery, and pediatrics who are interested in taking 1 to 2 gap year of research. And so on top of that, and as Josh mentioned, we have the weekly seminar series in which it's called the CVI Frontiers, and we essentially invite the best of the best across the country, if not around the globe, to come give a talk here at Stanford. Gives you a tremendous leverage, tremendous visibility for you as a cardiology fellow to be able to meet with a department chair, another institute director, cardiology division chiefs across the country. We also have several seminar series that fellows may be interested. For example, we have a seminar series in which we invite people who have had a second career or currently in the industry, and then they come and give talks about drug development, drug discovery. So it caters to postdocs and fellows who are thinking about having some kind of drug development career. So there are a whole bunch of these educational seminar series that we have that will be very helpful for the fellows. Just this year, we are implementing another program, which is the fellows could contact any one of the PIs, and so the PIs will meet with the fellows. The PIs could be outside of your research discipline, could be another department, and so forth. And the PI will be talking with you about your research career or think about, your grant applications and so forth. I can list a whole laundry of lists, but this is really a great program for fellows to come and if they're interested in the educational component of it.
Talk to me a little bit about your view of yourself as a mentor and the style that you have, and how you've been so successful in transitioning people to faculty jobs.
Well, I like to joke that I'm not going to win the Nobel Prize, but if my trainee wins the Nobel Prize, I, will be invited, to Sweden. But joking aside, I think, really, in my opinion, the primary reason why many of us stay in academia is all about mentorship, right? So you take gratification when your trainees gets a paper, gets a grant, gets promoted, because when your trainees look good, selfishly, somehow it reflects upon you that you look good. And so, mentorship is a key component of what I do. And I think if you look at our website, we've had like almost 30 trainees who become faculties, either in the US or abroad. I keep in contact with all of them. I still write them support letters. And it's also very gratifying when I get to meet with the trainee of the trainee who was previously my trainee. So this is something that I emphasize, and we have that culture here at Stanford, the Stanford family. And I certainly look forward to the fellows coming to Stanford interacting with them, either they're in the lab or in other people's lab, but creating that culture of collaboration, mentorship here.
You've made seminal discoveries in iPS cell biology and drug discovery. Talk to us about what you've got going on in the lab these days.
Yeah, so we have a lot of stuff going on, and a lot of it is actually translational. So I'm a cardiologist. I still see patients in the clinic, and I do inpatient. And in fact, Josh controls my destiny because he controls my inpatient cardiology schedule. But just like any other cardiologist, I see patients, and whoever is interesting, we're able to go back to the lab to study what's going on. So, we have a study using the iPSL, the genome editing, the sequencing methods, and other methods that are developed here at Stanford or elsewhere. We've been able to study, you name it, pretty much any kind of cardiology disease we're probably looking into. Just to name a few, we've studied hypertrophic cardiomyopathy, we've studied dilated cardiomyopathy, doxorubicin-induced cardiomyopathy, tyrosine kinase-induced vascular dysfunction. June Reed, who's one of the fellows working in the lab, just recently has a paper on iron overload cardiomyopathy. We're looking at long QT disease. This is part of a large Leduc Foundation grant in which we have collaboration with investigators in Europe, in Israel, and also in Japan. So there are a lot of stuff, and really the beauty is that you as a cardiology fellow, if you go see patients and you have an interesting clinical question, most of the time it stops there. But at Stanford, you really have the ability to go to the basic research lab, find out what's going on, and go back to the patient to provide better care, or what our dean likes to call, precision health.
Maybe talk a little bit about what you see on the horizon over the next 10 years for the CVI and research.
Yeah, so we actually moved to the new biomedical innovation building of BMI. I think it's 4 stories of. It is the newest building on campus, state-of-the-art facility, and we moved in there about 3 months ago. There are more and more people who move in, people from genetics, people from medicine, people from radiology, different departments all go there. I think it's going to be a very, well-nurturing environment to foster, promote research. I think in terms of the next 10 years, you will see a convergence of technology with genomics, AI, stem cells, you name it, and also convergence of technology and clinical work, clinical care, and also what Silicon Valley has to offer in terms of the latest innovation. And you'll see a lot of the top science that are is basically coming out of Stanford in terms of the area of sequencing. Just give an example, a lot of the technology with single cell sequencing, single cell ATAC-seq are all coming from various investigators here at Stanford. So if you want to be one of the first, this is the area really because of all the innovations that are occurring here.
Yeah, I think that's right. And with leaders like you, I think the future is bright. I've asked the questions that I wanted to ask. Is there anything else that you wanted to say before we conclude?
No, I mean, I just look forward to chatting with the prospective cardiology fellows who may be interested in coming to Stanford. I think, as I mentioned earlier, that there are really no drawback here. Maybe except for the high cost of living, high real estate values. But when you're a fellow, most of your time is spending working and coming to the hospital, coming to the lab. So that's less of a concern. But other than that, this is really the perfect, quote unquote, the perfect storm for people to come to do good work for the next 3, 5, 7, 10 years and to establish a name for yourself. And after that time, if you want to stay at Stanford and rise up the rank, perfect. after that time, if you want to leave and become chief of cardiology or director of institute or director of medicine or chair of medicine elsewhere, you've taken the best opportunity here at Stanford to be able to do that within that period of time. And I think, as you mentioned earlier, Josh, I certainly was able to take opportunity of all the factors and to be to leverage that and to be where I am today.
Well, thank you so much for talking to me today, Joe, and good luck with the rest of the day.
Thank you, Josh. Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.